please.
Help, please.
Help, please.
Help, please. Help, please.
You on?
Yeah.
Okay. Ready, set, go.
In it out. In it out.
Out. And she looked like a chicken.
Right.
She looked like a spring chicken.
Yeah.
Her feet were this big. Literally. Her arms were, I mean, her skin's just, yeah, it's...
And once we got into the NICU and Tina got a room, because she was going to be in a hospital for a couple weeks as well, trying to stabilize the issues that she had. And they put the baby in a NICU. Neither one of us had ever been in a NICU. Had maybe seen premature babies in pictures. When you first go into the room, it's quite an eye-opener. You're just not used to seeing babies that small and that tiny. You're not used to seeing them on oxygen, you know, just surrounded by all kinds of medical machinery. It's not the way you typically see a baby. You're looking at a fetus outside the womb, and not really like looking at an infant, because really that's what you're seeing. You're seeing, you know, in Gianna's case, a 24-weeker, but there's 26-weekers, 28-weekers, and you're not seeing a fully developed newborn. You're seeing what appears visually to be a fetus outside. And that was the first shock of not, you know, all the notions you had of what it'd be like to see a baby for the first time, and you're not seeing that. You're seeing something completely different. And, you know, it really tugs at your heart, too, so.
And when we went into the NICU, I was in a wheelchair. They wheeled me into the room, and I'm passing these babies, and I'm thinking, that's not so bad. Because some of the babies in there are 3-4 pounds. And I'm like, okay. You know, because you forget that quick. Like, they show you the baby, and then they take them. So it's like, and they wheeled me up to, she was on a warming table, not yet in an incubator, and covered by this tent. Remember that paper mache type tent?
Right. Under special lighting because of the skin.
Special lighting, not in an incubator yet. And the lady that was handling her was just amazing. And she said to me, she looks good. I'm looking at her like, are you kidding me? She looks like a chicken. That's not a baby. 10.5 inches long. So, and bright red, because the skin is see-through. You're at the stage where your skin hasn't thickened. So you can see the blood vessels and everything right through the skin.
Almost translucent.
And it's just, it doesn't look at all like a baby. And they just said, hi, Mom. What's the matter? What's the matter? You want to go down? You want to go up the slide? I bet
The first few weeks, maybe the first few months, really the whole time you're there, you're really just looking for little benchmarks that they hit. Small things, you know. Kicking the legs, moving the head. If they had a good day just on the oxygen, you know. There was good days, bad days. They tell you ahead of time it's a roller coaster, and it really is. It's an emotional roller coaster, and it's a day-by-day thing. And
they tell you they're going to call you if something happens. So the doctor came walking into the room a couple hours later. I'm a mess because I've got hormones. And I've got high blood pressure and a 14-ounce baby and separation anxiety because you can't hold your baby. So doctor comes into the room and I'm like, oh no, here we go. He says, you know what? She looks really good. She's in an incubator. You want to go visit her? You can go visit her. She looks pretty good. I can't promise anything, but she looks pretty good. So I go back down to the NICU and they start telling us what the machines are and what they do. And I'm not a medical person. I don't have any medical background. And they explained to me what blood oxidation meant and what the ventilator settings meant. And there's like lots of dials on there, and there's, you know, pressure settings and all kinds of settings on this machine. And I'm looking at these nurses like, how on earth do you know how to use this? I mean, these were the women. The doctors come at critical points. And in the very beginning, the doctors were there a lot. But for the most part, those nurses are incredible. And not only are they dealing with keeping a baby alive, they're also handling the emotional stress that I'm going through. And they're like best friends. As soon as you walk in there, these people are like hugging you, and because you stand there and you're just crying, looking at this little tiny baby trying to survive, you know, trying to breathe, fighting, and it's really.
And when you're in that
really
situation, you want to know what's happening with everything as far as the medical equipment. So, like Tina says, you become, every day you're getting educated on something new.
As a parent, I think it's your obligation to your child to learn as much as you can, because what happened in our instance is we wound up coming home with lots of issues. Oxygen, feeding machines, nurses in our house. And if I didn't know what I was doing, we wouldn't have had the success we had with this child. So when you're there at the NICU, you have to just get as much information as you possibly can from those people that are there. They said to me, you can probably hold her in a week, which is like the greatest thing in the world. And when I took her out to hold her, it was a production. It was like 4 nurses, you know, there's tubes, there's all kinds of tape involved. They have to take the child very, very slowly, gradually onto my chest. Don't make any movements, don't make any sudden noises. Everything needs to be very quiet and calming, because the child's supposed to be in your uterus still. So does Goofy like that ride?
Yeah.
Yeah? I think it's just a really big part of the child doing well and getting better is the love that they get from their parents. So holding them is so, so important. So even though it takes an hour, you know, to get the child in and out of the incubator, I think it's so important that they feel that love. I think it took her 3 weeks to reach 1 pound, and then she would gain about 1 pound a month. So when she left the hospital after 6 months, she was 6 pounds.
She was the weight of like an
Typical
average
newborn.
newborn after 6 months.
And she was 2 months, this was 2 months after I was due. So now, you know, and at this point, 6 months, you just want to take your baby home. Like, I know I'm going to have equipment, but please just let me out of here, you know? So, and at this point, they started to bring in, you know, they do the developmental care all along. They move their head from side to side, you know, every night so that you don't get that flat, preemie head. You know, they learn this, I guess, over time. They're starting to learn a lot more about it so that the bone structure, because it's so soft, doesn't get squished. So they move them on their, you know, their heads around a lot. They started putting pictures inside the incubator. All that developmental care is very important for their brain growth because, you know, let's face it, they're not supposed to be outside the womb at that early stage. So trying to help them, you know, make the connections in their brain that need to happen. And, you know, then they started bringing in, they said, can you bring in your mobile? Because we've never had a child here this long. She's 6 months old. She needs to be looking, her eye-hand coordination needs to start happening. So she's like 2 months past a due date now. So she's like a 2-month-old, really. You need a mobile. So I brought the mobile in. I bought a swing in the NICU. It's a slow uphill battle in the NICU. The growth is small. You just want to get out of there. You want everything to happen quickly, and it doesn't. It happens very slow. It's a lot of work. But she's amazing. She is just a typical 3-year-old child. We just hope that you know, this information is helpful. It's very scary to walk into the NICU. It's very scary to be thrust into, you have a premature baby.
You learn to appreciate it that much more. The little things, the bigger things, the milestones. You just learn to appreciate it that much more because you saw the struggle that your child went through, and it gives it that much more meaning.
Is that for great, Gianna?
Kisses.
So this is the 14-ounce miracle baby that we're so proud of. Right, sweetie? Are you a happy girl? Are you a happy girl?
Yeah.
Are you happy? Yeah.